Tribune. I want to welcome you to the Tribune's virtual event series, Coronavirus in Texas. As you know, around the state, a lot of in-person live events have been paused for the time being. Tribune loves to do in-person live events, but for now, we're moving our conversations online with a series of remote discussions on topics that matter. And there's no topic that matters right now more than the coronavirus in Texas. I'm so pleased to be joined by Steve Adler, the mayor of Austin. We're going to be talking for about 45 minutes, including your questions about this very important topic. We'll introduce the mayor in a second. If you have questions for the mayor that you'd like to have worked into the last 15 minutes of our conversation, please send us your questions on the event page at texastribune.org or tweet at us at #AskTrib. I want to thank the sponsors of this conversation who make today's event possible and support the Texas Tribune's public service journalism year-round. They are Blue Cross and Blue Shield of Texas, Community Health Choice, Methodist Healthcare Ministries of South Texas, and the Texas Association of School Business Officials. I also want to thank our media partners, Univision and KXAN, both of whom are streaming today's conversation. Also, any of you who are donors to the Texas Tribune, you make our work possible, as well as all of our other corporate sponsors and foundation supporters. I should tell you that all of our financial supporters play no role in determining the content, guest, or line of questioning at Tribune events. If you're interested in keeping up on the latest coronavirus news in Texas, please subscribe to our end-of-day newsletter for updates at trib.it/coronavirus. And again, remember to send in your questions for the mayor, which we'll ask in the last 15 minutes of our conversation. Go to the event page at texastribune.org or tweet at us at #AskTrib. Now it's my pleasure to introduce this morning's guest, Steve Adler, the mayor of Austin. First elected to lead the 11th largest city in the United States in 2014 and reelected in 2018. He's an attorney and one-time chief of staff and general counsel in the Texas Senate. A native of Washington, D.C., he's a graduate of Princeton University and the University of Texas School of Law. Please join me in welcoming the mayor. Mr. Mayor, thank you very much for being here.
Evan, it's good to be with you. Thanks for this opportunity.
Good morning. Mr. Mayor, it occurs to me that the last time we were together, it was right before your decision to shut down South by Southwest. That was on March 6th, less than 3 weeks ago. It seems like 3 million years ago at this point, doesn't it? Forever ago, you made that choice.
I can't even remember back to that. The South by decision itself was just over a week ago, and that feels like years ago.
Yeah, monumental. I mean, what's really amazing to me, Mr. Mayor, as I think about what's happened over the last couple of weeks, is the fragility of life as we knew it. I'm not sure that we really appreciated how fragile life was, but really in the space of just a couple of weeks, life as we know it has effectively disappeared, right? We're in a totally different world now.
We are, and still to be determined is how long this lasts, or what it is that world is on the backside of this.
Right. One big question that I think we don't have answered right now is what life looks like after this is over, because it will be over at some point. The problem is that we just don't know how much of what we took for granted before is going to come back, right? That's something that we just don't know.
And we don't know that, and we don't know how long this is going to last. And quite frankly, we have control over how long this lasts and what it looks like. And really, that's where I am. So it's hard for me to even engage yet. And what this looks like on the backside.
Got to live in the moment. Well, and to that point, yesterday, you and the Travis County Judge, Sarah Eckert, announced a stay-at-home order that as of midnight, we are now living under. I want to ask you exactly what stay-at-home means. Practically speaking, Mr. Mayor, before yesterday, restaurants and bars were closed. Today, restaurants and bars are closed. Nearly all of us were working from home before the stay-at-home order. We're still working from home today. Nearly all of us were too freaked out to do anything in public. That's the way it is now. Materially, Mayor, what is the difference between life before the stay-at-home order and life now under it?
You know, if only it were true that everybody was doing this before we entered the orders we did yesterday. Unfortunately, that's not the case. And quite frankly, we hadn't really given that kind of clarion call to people. So I understand the the public health people estimate that we were able successfully to reduce physical interactions in our community by 50%, cutting them in half, which is a pretty monumental kind of thing to have accomplished. But the modelers tell us we need to get closer to 90%. So what this did was it made very clear that even if you could work at your office, now is not the time to do that. We have too many people staying in their normal routine, going back and forth to work. We have too many people that are gathering together. If you went on the running trail here in the park, it was a beautiful day. We have too many people that are playing in very close proximity with each other. What we know is that this 50% is not good enough. And that's the difference. The difference is being able to convey to people that we're making life and death decisions here, and we have to be better. So what this order does is it makes very clear that unless your job is essential and critical, you need to stay home. The informal social gatherings that we have shouldn't be. We said no more than 10. There shouldn't really be any of those that are happening at this point. So this is to ratchet this up because the impact on the community is so great. Part of it is a communications issue.
Yeah, and you're convinced, Mr. Mayor, that the difference is that people were not listening to you, and because you put this order in effect, those scofflaws will effectively now listen to you. I mean, that's the part that I'm trying to understand. I saw yesterday Christopher Neely, who is the City Hall reporter for Community Impact, the newspaper chain, tweeted out yesterday at about 5 o'clock a picture of Barton Springs, the free side of Barton Springs. And it was like any day that you would see Barton Springs, where the temperature got up and people were out. People were absolutely closer than 6 feet. And you could see that people are not really listening to what you had all put into effect. So I get what you're saying. You think now, because you put this order in effect, those people who went to Barton Springs are not going to go? Is it shame? Are there legitimate consequences? Is there teeth to this order that people really are going to fear? That's the question.
Also backing up, and you talk about scofflaws, but understand that there was nothing in our orders that prevented a nail salon from continuing to operate or a barbershop from continuing to operate, because we hadn't screwed it down enough to stop that. But that shouldn't be happening right now in our city. Somebody who's working that close with successive people coming through. So part of it is a real substantive change. But yes, looking at what's happening at Barton Springs, we have to communicate to the entire community that this is really serious. So our ordinances need to track how serious this is. We need to actually have the orders in place. My hope is that when people see this, they will act more in accord, because now we are saying, be home.
They'll take it seriously. You think they'll take it more seriously? That's the point. That with the order in effect, they'll take it seriously.
And frankly, that's one of the reasons why we've taken the hard stance we have on construction in the city. These things are disruptive, and I recognize everybody wanting to hold on to as much of the normalcy of their life as they can, especially when there are huge economic implications of disrupting normal life. But we need to disrupt normal life.
So the consequences, Mr. Mayor, in the order are you can be fined up to $1,000 and jailed for 180 days if you disobey the stay-at-home order. That's right?
That's correct.
Can't that be seen as kind of weak, Mr. Mayor? If you really want to give people a reason to not disobey this order, why not jack up the fine? Why not jack up the jail time? Why not put real consequences and real teeth in this order?
Well, cities have a limit to the amount of penalty that we're allowed to put in the ordinances that we adopt. It's going to take the state acting or the federal government acting to put that kind of teeth in an ordinance. But beyond that, we obviously don't have the capacity to be able to enforce something like this through jail time and fines. This has got to be something that our community decides is important enough to do. We have to police ourselves. You know, when we announce that people going to the grocery store, as they have to be able to do, and they still can do under the order that was adopted, people shouldn't be in line within inches of one another, within a foot or two of each other. And that's what we were having, these long lines, people crammed together. We came in and talked to the passed an order that put part of the burden and the onus on the stores to make sure people standing in line are 6 feet apart. And by and large, we're seeing that. And we're seeing people in line in stores announce to the group, hey, we are way too close. We need to spread out. And anecdotally, I've heard of that happening several times. Every time someone stands up and does that, what I hear is everybody adjusts. And quite frankly, everybody's happy that somebody said something, because they were all in line feeling uncomfortable with how close they were to the people on both sides of them and didn't know what to do about it. This isn't going to work because we have jail time or a fine. This is going to work when a community says this is important.
Yeah, it's got to be self-policing. So if my daughter, who lives 5 minutes away, decides to drive over to have dinner at our house, she's not going to get stopped by a cop. That's the point.
There's no way this thing will work if that's what we're looking for to enforce this.
Or my son drives across town to go hang out with his girlfriend, which probably is in violation of the order. Again, any parent might have this question about any of their kids. That's not really the point here, is not to bring the law enforcement piece in. It's more about your own behavior and trying to motivate your own behavior in line with the intent of the order.
That's right. You policing your own behavior, but you also being verbal about what it is that you're saying. So as people in our community see that some people are putting all our lives at risk, when they see that, they should say something.
See something. So the order is in effect until April the 13th. Is it possible that you'll make a decision sooner than that to lift the order? Is it possible that you decide to extend the order beyond April 13th? It's just April 13th for now?
It's April 13th for now. And you talk about how much the world has changed in the last week since South by.
Right.
I predict that in this next week, the changes are going to be even greater. If you look at what's happening with the escalation right now in New York, and the governor indicated that his peak was coming sooner than he thought, more rapidly than he had envisioned. And when he looked at the TV cameras, and he's looking at this escalation, which is what we see in the modeling. If you're not able to get out in front of this, and it is ferocious, and the Governor Cuomo looking at the camera yesterday at the rest of the country, and I'll tell you, he was looking at us, and he was saying, I am your future. You look at me right now, because I am you in 2 or 3 weeks. And the truth is, unless we can do better and different than we have been, that's true.
Right. Yeah. As we were sitting here waiting to go on today, a note came across our devices that the Austin Independent School District, which had previously had schools closed until the 3rd, has now gone to the 13th to align with your stay-at-home order. Yesterday, in the announcement of the stay-at-home order, Dr. Mark Escott, who's the interim health authority for Austin and Travis County, called for schools to stay closed for the remainder of the school year. Why are we not just acknowledging reality? Why are we not just saying, so that parents have certainty, so kids have certainty, so school district employees have certainty? Why not just go ahead and close the schools now for the rest of the year?
I don't have the ability to be able to do that as mayor of a city. Schools are in independent districts. I would imagine our governor has the ability to be able to do that. I do not. And right now, we're not taking those kind of statewide actions. But I do think that the TEA, I do think that this deserves that kind of statewide consideration. All we can do is make public and transparent and apparent to our community the information and data we get when we have it. So when our health director said, I'm looking at this and it doesn't look to me like schools are going to come back this semester, I urged him when he went to the microphone to say that out loud.
So it would be your recommendation, Mr. Mayor, if you had the control over this, it would be your recommendation that schools not reopen this calendar year, or this school year, pardon.
I would follow the advice of my health director.
So yes, you would like to see schools not reopen. Yes, that would be your preference.
That's what the director is saying at this point.
Yeah. Yesterday, Mr. Mayor, the president talked in different settings about the possibility of reopening the country for business on Easter. Or by Easter? How do you feel about that?
It leaves me speechless. Quite frankly, a big part of the country, including us, are going to be on the upside of the whatever peak we have. with infections and spread in our city. And I think much of the country is going to be in the same place. The thought or expectation that this is going to be over in 2 weeks, I think, hurts us because it creates the impression that this is a 2-week thing. Don't worry about it, and there's nothing really we need to do other than just wait. In 2 weeks, it'll be behind us. Right. And that's not the case. And right now, our biggest challenge is in getting people to understand the severity and seriousness of what we're dealing with, and the ability for individual action and collective action to change the course of what it is that happens to us. And that is not aided by suggesting things that are not true. So you was disappointed to hear that.
You believe the president has done a good job or a bad job handling this? I see in the polls this morning that a majority of the country thinks that the president is handling the coronavirus situation well. What do you think?
I'm very disappointed in our federal response to this. I know that we do not have the supplies of personal protective equipment that our first responders and our healthcare directors need. We do not have the tests that we need. At this point, we don't have the ventilators and respirators that we can know from modeling that our community and other communities are going to have to need, so we don't have to make choices about two people and which one gets to live and which one doesn't, because we don't have the equipment. I wish our federal government months before now had been acting to build those supply chains in anticipation of what we're dealing with, or acted sooner at any point. So I'm disappointed. And then the president, whose voice is so powerful, a president's voice so powerful in a community, could be rallying us to understand that we can impact the trajectory of this and rallying the country and getting everyone focused. We would be doing a better job in Austin right now in determining our fate if it was something that the president was talking about. But he's not. In fact, he's suggesting otherwise, which is why we have so many people at Barton Springs right now. You know which age group it is, by the way? That is the age group in our city, percentage-wise, that is contracting this virus more than anybody else? 20 to 29-year-olds.
It's young people, as in some other places. There's been this myth that if you're under the age of 60 or something, you don't have vulnerability, but we're seeing those numbers in the opposite direction, right? Younger
greatest percentage is 20. The next one percent is 30 to 39. Right. And even if those people don't exhibit the severe symptoms, they become carriers. And quite frankly, everybody else in this city is put at risk, the degree to which that age group is out in front, and they need to know that.
Yeah. How do you think the governor's doing? You've said that you're disappointed in the president. Has the governor done a good job in leading so far on this issue?
You know, I wish the governor was stronger. I wish there was a statewide response to what's happening, because I think it would be more powerful. At the same time, the governor is not joining with President Trump in suggesting that this is not serious. He has recognized that we have control over this. He's described accurately what it is that we're trying to do in flattening out the graph. I disagree with him when he suggests that the supply is more readily available and is going to be sufficient at this point, because we're not seeing that on the ground. Yeah. But mostly I wish there was a statewide response. You know, one of the most, I think, spectacular things that happened over the last 24 hours is that with the governor not moving to establish norms or standards of what cities should be doing, you had in almost at exactly the same time, because we were working with one another, our attorneys working with them. You had Dallas and Dallas County, you had Fort Worth and Houston and San Antonio, you had Bell County and Waco, you had Austin,
you had El Paso.
Everybody stepping out at the same time, cities and counties leading the response to this in the material and disruptive ways that are most important for us to be successful.
But Mr. Mayor, there's an inconsistency to the ways they did it. The stay-at-home orders are very similar, but Tarrant County, Fort Worth, Harris County, Houston, their stay-at-home order lifts on April 3rd. Bexar County's stay-at-home order, Mayor Nirenberg and Bexar County officials, Judge Wolf, on April 9th. Travis County, April 13th. Isn't this a problem? Isn't this the patchwork quilt that we've heard so much about in the fight over local control over the last several legislative sessions?
You know, it's ironic that on this issue, I find myself asking for the state to intervene, in a way after I've just gone through several legislative sessions where I've argued for local control. But this is the kind of time when we need state action. I think we're remarkably close for different cities and counties around the state trying to reconcile with one another. And we were passing drafts back and forth and ideas and concepts back and forth. And the question
so why
arose,
not align the closing date, Mr. Mayor? Why not, if you're all working together, if your attorneys are working together, if you're in hive mind mode, why not have the end date of these stay-at-home orders be consistent across these big counties?
If we wanted to wait another 2 or 3 days, we probably could have ironed out a lot of the differences. I mean, for 90% of these different orders in different cities and counties, they're similar. But when they came to us and said, hey, we think we can iron these things out and get more aligned, just going to take us another couple days, 3 days, we said no. Because each day has such a geometric impact on what happens. We said, get it out. And we'll worry about the discrepancies over the next few days. Get it out.
That's another point. Are you calling them when you say that you wish there was a statewide response? 65 of the 67 House Democrats in the Texas legislature yesterday signed a letter asking the governor to do a statewide lockdown. Right? We need a statewide response. Are you calling for the governor to do a statewide lockdown?
Well, lockdown is a word I think that goes too far because we're saying you not have to stay in your house. You can go out and jog and run.
Call it what you want. What Governor Newsom did in California, what Governor Cuomo did. Right. What about Governor Abbott? Should he follow those guys?
Yes, there should be a statewide stay-at-home ordinance. Stay home and work safe. Absolutely. The governor talks about a lot of parts of our city where it hasn't manifested itself the way that it has in other parts of the state. My health people tell me that the virus is in every one of those places. And it's going
even though we've only had cases in some percentage, 25% of the counties so far have had incidences of the coronavirus. Right. And if you look at the map on the DSHS website, it's largely east of Interstate Highway 35. If you look west of Interstate Highway 35, you kind of understand what the president was saying yesterday, that there are whole parts of Texas where there seems not to be much incidence of this. You're not buying it, even though we've only had in a quarter of the county so far cases.
I'm not buying it. And the health people tell me that that's not true. 40 to 80% of the people in the country are going to get this. This is going to be and is everywhere. And the only question is, does everybody get it all at once? And I am concerned about the more rural areas in our state. And I'm concerned because at this point in time, they could really impact what it is that happens in their local communities. And they're missing the opportunity to do that because they don't have the resources to have the same kind of modeling and public health experts and information that we have, that the governor has.
Response. The healthcare resources there are also not what there are in the big cities.
And they aren't. So imagine what happens. So when it hits those communities, and it will, they're not going to be in the position to be able to deal with it. So where do they go? They're going to be reaching out to the big cities. And quite frankly, at the time that they're reaching out to the big cities are going to be overtaxed. The big cities aren't going to be able to take care of themselves unless we can reverse this. So I am real concerned, and I wish there was a statewide response at this point. We need a statewide response at this point.
So let's talk about the overwhelmed cities and your city specifically. So as of last night, Travis County has announced there are 98 confirmed cases of the coronavirus. And as far as we know, no deaths so far. Can you confirm that? No deaths?
Yes.
Right. How good, Mr. Mayor, is that data?
There may be one. I'm not sure.
There may be one, because as of right now, I'm not sure that we've had a death reported in Austin or Travis County to this point. Do you think there may be?
Because if it hasn't been reported, then it hasn't happened, because we're reporting the data as we know it.
Okay. I want to ask you how good the data is.
But there will be deaths.
Well, we know that there'll be deaths statistically, but here's the point I want to make. Health authorities are operating under the assumption that the county actually has 7 times more cases than what has been confirmed. Isn't that right? That Dr. Escott is suggesting that if we have 98, actually, we might really have more like nearly 700 cases. Is that also your assumption, that we're undercounting?
Yes.
Yeah. Why can't we get better data on this stuff? Is it about not having adequate testing? What is it?
Yes, we don't have enough tests to be able to test the population indiscriminately in order to really ascertain what percent has it. And that's because we have so few tests relative to the need. We have to make sure that we have tests put aside for first responders and for healthcare workers because they're on the front line. We have to have tests for people that are older and more susceptible and at greatest risk of dying because of this. We don't have enough tests to know. So we have to make assumptions. And we also know that the spread of the virus is different. It's a very infectious virus, and it spreads without people knowing that they have it. You know, the numbers show that the flu, when it spreads, you average person who gets the flu, it's an infectious disease. You infect 1.2, 1.3 people, and then those 1.2 or 1.3 people infect another 1.2 or 3. When you do that 10 times, that first person has effectively or indirectly affected 19 people. If you take that 1.3 number and move it to 3, and this virus is expected or anticipated or believed to infect at a rate that's somewhere between 2 and 3. But if you use 3, you get it. You give it to 3 people. Those 3 people give it to 3 people. If you do the same 10 transfers instead of 19 people, it's 59,000.
59,000, right? Yeah, that's the number they keep quoting. So so that's the problem. That even if you're asymptomatic, you may be giving it to other people, and the numbers are going to continue to grow. And in fact, Dr. Escott said yesterday that the current modeling of the spread, and the University of Texas is taking a lead, as I understand it, on the modeling of this, shows that the area will hit its capacity for hospital beds and ventilators based on that spread as early as 3 weeks from now. That's your understanding. We're 3 weeks away from hitting capacity. And that if the virus goes unchecked, we would need 20,000 hospital beds a day to treat those infected. Correct?
And understand, we're only at that place because of the steps that we've already taken. Because we reacted the way that we did with South by, we reacted the ways that we did. If we hadn't done that, it would be hitting us much sooner. We would be much closer to what's happening in New York right now. And the hospital capacity would be almost 30,000. So at the 50% decrease in physical interactions, we have saved ourselves by 10,000, but we're still 20,000 underwater. So there's still work that we need to do to push this out longer and to decrease that. I mean, at 20,000 beds that we have to find, I mean, you're starting to take over hotels. We could have tents on auditorium shores with cots.
Well, I wanted to ask you about that. You know, are you thinking about turning a city-owned facility, something like the convention center, into a hospital in the same way that in New York they've turned the Javits Center into a hospital? It wasn't done easily. It required federal help. But you presumably have the same access to the city-owned resources that other mayors or other governors do, right, in other cities?
The city and the county and the area and the region has contingency plans to be able to build out to meet the need. I mean, we're going to do that, but it's not going to be pretty, and it's not going to be as effective at saving people as if we made it so that our hospitals could manage the load.
How many ventilators do you need, Mr. Mayor? I heard Governor Cuomo yesterday say that FEMA was sending 400 ventilators. They needed 30,000. Now FEMA is sending 4,000 after he made that complaint yesterday, but still they're going to be way beyond they're way under what they need. Do you have a sense of how many ventilators you have access to and how many you need that you don't have access to?
You know, I don't have those numbers in front of me, and I don't know what they are offhand, but that is the biggest issue that we ultimately have, that any community ultimately has. And we are at this point right now trying to source more ventilators for our city.
And you're being put in a position because there's no coordinated effort to get ventilators distributed. You're competing with other cities, presumably. We've heard other mayors and governors say we're having to outbid each other for effectively these services, right?
We are competing with every city in the country right now. I would hope that at the federal level, we have plants that are converted to this use, and we are producing more and more ventilators. We should have been doing that 2 months ago.
Houston is complaining that they're about to be out of swabs and that they may be forced to close testing sites. Do you have enough testing sites? Do you have enough swabs? Is Travis County at risk of also having to shut testing sites down as a result of a lack of supplies?
We don't have the supplies that we need to be able to do the testing that we want to do, and we don't see that happening on the horizon. But it's an area that we don't ultimately know the answer for, because the supply chain is uncertain with respect to those. But as we sit here right now, we don't have the tests that we need. There are a lot of people in our community that would like to be tested now and are really frustrated with the fact that they can't get a test. But we have to give the tests we have to those that are in greatest need of getting those tests.
So the idea that people who are asymptomatic should not get tested, you're for that in large measure because it's the only way to limit the number of people who have access to a limited number of tests.
That's correct. I mean, right now, nobody should be going outside if they're sick. And probably more important than anything else, because people know when they're not feeling well, they shouldn't be around anybody. They should
stay inside,
isolate themselves and stay inside. But yes, we don't have enough tests to give all those people tests.
Mr. Mayor, have you been tested?
I have not been tested.
You have no reason to be tested.
I have no reason to be tested. To my knowledge, I haven't been around anyone who has tested positive for the virus, and I don't have any symptoms at this point.
So you're not in the quarantine, self-quarantine. You're not quarantined either. Okay. Let me ask you a couple questions about the economy, and then we're going to go to audience questions. I want to know what your modeling within the city says about the impact on the economy of this crisis. We heard over the last couple of days statewide numbers from the comptroller on a call with legislators. The comptroller was reported to have said he thought that there might be a hit of several $1 billion to the state budget and to the rainy day fund. Yesterday on the Texas Standard Show on public radio, we've been at the state level and historically low unemployment. The comptroller was talking about the possibility that we're going to get to 9% or even into double digits at some point, which would triple where we've been in terms of the unemployment rate. What are you hearing about the city of Austin, either on unemployment numbers or the impact on the economy? Can you quantify the impact for us?
I can't yet. My hope is that within the next several days, we'll have a better feel for numbers and projected numbers. But I will tell you that anecdotally, the economic impact is obvious and severe and horrible. And quite frankly, the economic crisis that we have is every bit the crisis that the virus is. We have way too many people in the city that are out of jobs right now, which is why we're taking actions to make sure that evictions don't happen. The utility companies will not be turning off water and power to people. We're doing everything we can. The city council is going to consider our own economic package to help with rental assistance and mortgage assistance. We need the federal government to speed that money and relief to cities all across the country. So I don't have the numbers yet to be able to talk about them, but the impact is horrific.
You have no doubt that the unemployment rate in Austin, which has been at about 2.5% seasonally adjusted, 2.5, 2.6%, you have no doubt that those numbers are going to double or even triple. They're going to go up significantly.
They're going to go up significantly. They already have gone up significantly.
Right. Does the plan out of the federal government, and again, overnight we had the stimulus plan, phase 3, I think it is, that passed. Does it give you hope that small businesses with assistance from the federal government in Austin can survive this? Austin is a very particular city in terms of independent businesses, restaurants, and all that, the things that we all talk about as making Austin, Austin. What's the impact on those businesses going to be? Is there some combination of federal and local relief that can keep those businesses open, or are we just going to have to prepare for the disappearance of iconic Austin businesses?
I think we have to do everything we can in order to preserve and help as many businesses as we can survive. But you're asking me, we're going to lose some because that is the impact of this. Austin was one of the last cities to go into the recession that we had before, one of the first cities to come back out again. I really do believe that on the backside of this, because there will be a backside of this, that our city is going to recover again first and strongest because of the underlying strength of what it is that makes up our economy, and because of the character and nature of the people that live in this city. It's a very entrepreneurial town, but the impact is severe, and we shouldn't pretend otherwise.
Last couple of days, as you know, as a consequence of the lieutenant governor's comments on Fox News 2 nights ago, there's been a discussion about the economy versus public health. Some have suggested, like my colleague Ross Ramsey, that it's a false choice. But I want to ask you if you believe that there is a discussion to be had about whether we should be prioritizing the economy over public health, or I wonder if you would react to this discussion that the lieutenant governor has caused to happen over the last couple of days.
I had trouble coming up with words to even explain or describe that conversation to people that were asking me about it. I will tell you, from our perspective, the decisions that we are making are decisions that are motivated by public health and saving people's lives. You know, the difference between us being at 50% reduction of physical interactions and us being at 90%, just in our 5-county area, are about 5,000 people, it's estimated to be right now. We'll see the modeling here later today or tomorrow, get the exact numbers, but it is thousands of lives that will either be lost or not lost based on the decision that we make. And that's very real for me. And the decisions that I've been making and the county judge have been making, we were looking at people's lives and people's health. I also believe that that's ultimately the way to preserve the economy and to bring back the economy as rapidly and as strongly as we're going to be able to do that. You look at the cities,
prioritize public health to get back to a good economy.
Correct. And because it speaks to who we are as a people and community, it speaks to our values as to who we are. It's hard for me to even understand an equation that works the other way in this instance.
Yeah. Let me quickly jump in with a couple of audience questions, Mr. Mayor, before we let you go. Has there been a noticeable impact on the homeless population in Austin? Questioner asks. That's obviously been a big issue in Austin, or it was, the discussion of the policies around homelessness. Anything extra being done to address the specific needs of the homeless population in Austin?
You know, I'm really concerned about that population because they're one of our most susceptible populations, and it's one of the hardest populations to be able to get them to physically separate. They can't all go to their own rooms because they don't have rooms to.
You can't work from home if you don't have a job and you don't have a home, right?
You can't work from home when you're already working from home, because that's where your home is. So we have at this point a block of rooms that are available. So if anyone in that community gets a positive test, we have a way to be able to isolate them, and a way to isolate the people around them. We have capacity to be able to deal with that. So we have the contingency fee planning for that. But ultimately, this community needs to solve the homelessness challenge so that this susceptibility that exists in our community does not exist long term. But for right now, we just have to make sure that we have the contingency planning, and we do, for what happens when, and I believe it is a question of when, not if, someone in that community tests positive.
All right. Last question, Mr. Mayor. What can we learn from this outbreak, or what have we learned in terms of where the city might have prepared on the front end for this? What changes will result from what we're experiencing now in terms of planning post-pandemic? How do you rethink prep for this? What changes in operation? What cushions for small businesses do you need to have in effect as triggers? What have you learned about what you need to do going forward?
Well, I think that, quite frankly, whenever I would hear about the flu pandemic in 1917, 1918, I could never even imagine that happening in the modern era. At some level, I guess I thought that we had gotten to the place where that thing just couldn't happen to us. It's really clear and obvious now just how wrong I personally was, because we see it happening. I wish that we had had a real strong national response back in January to what's happening, and all the information existed back in January for us to know what it is that we needed to do.
But is there more, Mr. Mayor, that you at the local level could have done?
Yes, I mean, if we had known what was happening in January, we probably would have known to pull the plug on South by sooner than we did, to recognize that nobody was going to be having those kinds of meetings in our community, in our city. You know, this takes 2 weeks, a week and a half to 2 weeks to manifest, which means the positives that we have seen over the last several days were positives that were set back at the time that we were canceling South by. You know, if we had started to recognize this in our community, there were things that we could have been doing a month ago in terms of behavior to flatten this out. But I also think that we have to look at resiliency planning. We have to look at reserves. Businesses, individual businesses need to have better planning for what happens when this comes. What's my plan at this point? What happens with people and employees? You know, so that we can keep people going.
Right.
We had contingency plans, but they were frankly not up to this kind of a challenge. Wow. And we were dealing with contingencies associated with the health issues, but less the contingencies associated with the economic issues. And I think that those are all lessons.
Hard to predict something this big. I mean, truly. Right on the front end. Mr. Mayor, thank you so much for taking time with us this morning. We appreciate your being here. To everybody out on the live stream, thank you so much for watching our conversation with Mayor Steve Adler. Thanks to everybody at the Tribune who made this possible. And we will be back soon with more events in our remote Coronavirus in Texas series. For the Texas Tribune, I'm Evan Smith. Have a good day. Thanks.